My father is 74 years old. He is healthy, active, and takes his health seriously. And when he called me last year telling me his doctor had prescribed one of the medications I'm going to show you today, I asked him not to take it until we had talked. He was surprised. It was a legitimate prescription from a doctor he trusted for a real problem. But I am a urologist. I have spent 18 years studying exactly what these medications do inside the body of men over 60, and what most family doctors don't have time to explain in a visit, what the studies show about what these drugs do to the prostate, the bladder, and the brain over time, is the reason I would never let my father take any of them without a very serious conversation first. Today, I'm having that conversation with you. 3 medications, all legally prescribed, all given every day to men over 60 with prostate problems, and all carrying effects that most patients were never told about before they filled the prescription. Stay with me until the end, because the third one on this list is the most surprising, and almost certainly the most common one sitting in the medicine cabinet of men your age right now. My name is Dr. Jane. I specialize in men's urological health and prostate wellness for patients over 60. And what I'm about to share with you is the conversation I wish every man over 60 could have with his doctor before swallowing a single pill. Before we get into the list, I need you to understand one fundamental thing about how medications interact with the body of a man over 60, because what is safe at 40 is not necessarily safe at 65. And that distinction is at the heart of everything I'm going to show you today. Think of it this way. Imagine the plumbing system of a house that has been running for over 60 years. The pipes still work, the water still flows, but the walls of the tubes are thinner. The connections are more sensitive. The pressure the young system absorbed without issue can now cause leaks in places you never knew were vulnerable. The body of a man over 60 works the same way. The liver processes medications more slowly. The kidneys eliminate substances less efficiently. The brain becomes more sensitive to compounds that cross the blood-brain barrier. And the prostate, already under stress from decades of hormonal exposure, reacts in ways that recent studies are only beginning to fully document. This does not mean medications are the enemy. It means context matters, age matters, and the conversation that many doctors don't have time to have matters more than most patients ever realize. That is why I am having it now. Medication number 3, the one that seems completely harmless because it doesn't require a prescription, and that is exactly why it is so dangerous. I am talking about over-the-counter anticholinergic sleep aids. Specifically, the products containing diphenhydramine, the active ingredient in Benadryl, Zizquil, Simply Sleep, Unisom, and dozens of other nighttime medications sold in every pharmacy and grocery store in the country. I know what you're thinking. That is not a prostate medication, and that is exactly the problem. Men over 60 with prostate symptoms frequently sleep poorly. They wake up multiple times a night. They feel exhausted during the day, and what do? They pick something up at the pharmacy to help them sleep, something without a prescription, something the box describes as gentle, natural, and non-habit forming. What the box does not describe is what diphenhydramine does inside the bladder and prostate of a man your age. Diphenhydramine belongs to a class of drugs called anticholinergics. It blocks the neurotransmitter acetylcholine throughout the entire body. And one of acetylcholine's critical jobs is controlling the muscles that allow your bladder to contract and empty completely. When you take a diphenhydramine-based sleep aid, you are chemically impairing your bladder's ability to empty. For a younger man with a healthy prostate, this is mildly inconvenient. For a man over 60 with any degree of BPH, with an already narrowed urethra and a bladder already struggling to clear completely, this can cause acute urinary retention, the complete inability to urinate. a medical emergency that sends men to the emergency room far more often than most people realize. And there is a second problem that is even more serious for men your age. In 2015, a landmark study published in JAMA Internal Medicine followed nearly 3,500 adults over the age of 65 for 10 years. The findings were unambiguous. Regular use of anticholinergic medications, including over-the-counter sleep aids containing diphenhydramine, was associated with a significantly increased risk of developing dementia. The more frequent the use, the stronger the association. This is not a small study. This is not preliminary research. Nearly 3,500 people. 10 years of follow-up. Published in one of the most respected medical journals in the world. I had a patient I'll call Harold, 72 years old, retired teacher from Georgia. Harold had been taking an over-the-counter sleep aid almost every night for 3 years. He came to my office with urinary symptoms that were rapidly worsening and a level of mental fog that was beginning to worry his family. When I reviewed everything he was taking and explained what diphenhydramine does inside the body of a man his age, he went completely still. Then he said, "I bought this because the box said it was safe, because it didn't need a prescription." We stopped the sleep aid immediately. Within 6 weeks, Harold's urinary symptoms had measurably improved. Within 3 months, his family told me he seemed sharper, more present, more like himself again. If you have any product containing diphenhydramine in your medicine cabinet right now, please speak with your doctor before taking it again. There are safer alternatives, and your brain and your prostate will both benefit from making the switch. Medication number 2, the one your cardiologist prescribed to protect your heart, and that may be quietly working against your prostate at the same time. I am talking about calcium channel blockers. Medications like amlodipine, nifedipine, and diltiazem, widely prescribed for high blood pressure and cardiovascular disease in men over 60. Let me be clear about something before I continue. These medications are often essential. They save lives. If you take a calcium channel blocker for your heart, do not stop taking it because you watch this video. This is a conversation to have with your doctor, not a decision to make on your own. But here is what your cardiologist most likely didn't mention, not because they are hiding information, but because medical specialties often don't communicate the way they should. Calcium channel blockers cause smooth muscle relaxation throughout the entire body. That is precisely why they work for high blood pressure. They relax the walls of blood vessels. But smooth muscle is not only in blood vessels. It is in the bladder sphincter. It is in prostate tissue. It is in the urethra. When you chemically relax that musculature, the bladder loses part of its ability to contract with enough force to empty completely. The result is increased post-void residual, the volume of urine left behind after you think you are done. And that residual is what triggers the cycle of nighttime urgency that keeps men awake for hours. A study published in the Journal of Urology demonstrated that men taking calcium channel blockers chronically had significantly worse nighttime urinary symptom scores than men with similar blood pressure controlled through other medication classes. The effect was independent of prostate size. And there is a second effect that is almost never discussed. Calcium channel blockers cause ankle swelling during the day, fluid accumulation in the legs while you are upright and active. When you lie down at night, that fluid does not stay in your ankles. It gets reabsorbed into the bloodstream, processed by the kidneys, and sent to the bladder at 1 a.m., at 3 a.m., at 5 a.m. You are not waking up because you drank too much water. You are waking up because the medication protecting your heart is redistributing fluid from your ankles to your bladder while you sleep. I had a patient I'll call George, 69 years old, retired engineer from North Carolina. George had been taking amlodipine for 4 years for hypertension and woke up 3 times every night without exception. 2 different urologists had evaluated his prostate. Normal, no significant structural problem. When I reviewed George's complete medication profile and identified the pattern, we worked with his cardiologist to explore an alternative class of antihypertensives. Within 8 weeks, George was waking up once a night, sometimes not at all. His blood pressure stayed controlled, his kidneys stayed protected, but his ankles stopped accumulating fluid during the day, and his bladder stopped receiving it at 3 a.m. The message is not to stop the medication. The message is to bring this video to your next appointment and ask directly, is there an alternative that controls my blood pressure with less impact on my bladder function? That one question could transform your nights. Before we get to medication number 1, the most surprising and the most common among men your age, I want to take one moment. If this video is giving you information no doctor has ever had time to sit down and fully explain, hit the like button right now. It takes 1 second and puts this content in front of the men who need to hear it today. And leave me a comment. Are you currently taking any of the medications I've already mentioned? You don't need to go into detail. A simple yes helps me understand what to cover next. And for the men who want to give the prostate active nutritional support while navigating these medication conversations, I've left a link in the description. A natural formula with over 20 clinically researched ingredients, including saw palmetto, pygeum, and green tea extract, each one selected for its documented role in prostate health and healthy urinary tract function. No prescription required. Every order is covered by a full 180-day money-back guarantee. For the men who want natural prostate support alongside the important medical conversations, this video is going to inspire. The link is in the description. And now we arrive at number 1. The medication that concerns me most. The one I would most firmly ask my father not to take without an extremely serious conversation first. I am talking about 5-alpha reductase inhibitors, finasteride and dutasteride, widely prescribed for BPH, benign prostate enlargement, and for hair loss in younger men. And before you think you already know everything about these medications, I need you to understand what studies published over the last 10 years are revealing about what they do beyond reducing prostate size. The mechanism of these medications is to block the conversion of testosterone into dihydrotestosterone, DHT. DHT is the primary hormone responsible for prostate growth. Blocking it causes the gland to shrink. For many men, this significantly relieves urinary symptoms. And in that specific context, the medication does exactly what it promises. The problem is that DHT is not only in the prostate. DHT is a critical hormone for neurological function. It has receptors in the brain. It regulates neurotransmitter synthesis. It is involved in the regulation of mood, cognition, memory, and sexual function at levels that medicine has significantly underestimated for a long time. When you systematically block DHT production throughout the entire body, you are not just reducing prostate size, you are altering the hormonal chemistry of a man's brain over 60, a brain already navigating the natural decline of testosterone and the cognitive changes associated with aging. In 2021, a study published in JAMA Neurology analyzed data from over 60,000 men and found a statistically significant association between the use of 5-alpha reductase inhibitors and increased risk of depression, persistent erectile dysfunction, and cognitive impairment. What was particularly alarming was that in a proportion of men, the effects persisted well beyond discontinuation of the medication. This syndrome has a name, post-finasteride syndrome, and while it is still debated within the medical community in terms of exact mechanism, the clinical reality I see in my office is unambiguous. Men who arrive complaining of depression that began after starting the medication. sexual dysfunction that did not resolve after stopping, mental fog that was not there before. I had a patient I'll call Richard, 66 years old, retired attorney from Massachusetts. Richard had been taking finasteride for 2 years for BPH. His urinary symptoms improved, but at some point during that period, he began to feel different, less motivated, less present. His wife noticed before he did. When Richard came to my office and described the complete picture, we worked with his family doctor on a gradual transition to an alternative approach to prostate management. It took months. It was not immediate, but Richard eventually told me he felt like he was coming back to himself. The point is not that finasteride is always wrong. For men with severely enlarged prostates, serious symptoms, and no response to other approaches, the risk-benefit conversation may very well favor the medication. Medicine is always an individual equation. The point is that the conversation about risks and benefits needs to actually happen, that the neurological and psychological effects need to be on the table before the first dose, and that men over 60 with hormonal chemistry already in natural transition deserve a particularly careful evaluation before systemically blocking a hormone their brain depends on. When my father called me with that prescription in his hand, it was finasteride, and the conversation we had was exactly this one. I didn't forbid him from taking it. I sat with him, reviewed the studies, discussed the alternatives, and together, with his doctor, we arrived at a plan that made sense for his specific profile. That is what I want for you too. Here is what to do with everything you just learned. Write down every medication you currently take, prescription and over-the-counter, and bring that complete list to your next appointment. Ask your doctor specifically to review each one in the context of your prostate and urinary health. Not in general terms, in specific terms. If you take any over-the-counter sleep product, check the label tonight. If the active ingredient is diphenhydramine, speak with your doctor before taking it again. Safer alternatives exist. If you take a calcium channel blocker and are waking up multiple times a night, ask your prescribing doctor directly whether an alternative class of antihypertensives might offer better urinary outcomes for your specific profile. And if anyone has prescribed finasteride or dutasteride for you, do not start it without a complete conversation about the neurological and psychological effects documented in recent studies. Ask for a second opinion if you feel you need one. That is your right. The men who protect their prostate health most effectively are not the ones taking the most medications. They are the ones asking the right questions, treating every prescription as the beginning of a conversation, not the end of one. You now have the questions. What you do with them starting today is what will determine how you feel 6 months from now. And for the men who want to support the prostate naturally with the plant compounds that research has validated and that work without the side effects we just discussed, the link is in the description. Over 20 clinically researched ingredients, including saw palmetto, pygeum, and green tea extract, each one selected for its documented role in prostate health. No prescription required. Full 180-day money-back guarantee. The only thing you have to lose is another night waking up at 3 a.m. The link is in the description. Share this video with one man who needs it. Subscribe with the bell on. And next week, I am going to show you the 5 early warning signs that your prostate situation is progressing faster than it should. Signs that most men dismiss for 12 to 18 months before finally getting help. You do not want to miss that one.